Hello, my name is Dr. Luis from Home International Pet Hospital.
Hello, my name is Gosia. I came here for ultrasound training.
Yes, we already did a private lecture about organs in abdominal ultrasound, and today we are going to show you some case. And the first case is about one big cyst on the kidney. So maybe you can talk about a little bit of history of this dog. Do you know the history of the dog?
The dog came to the clinic and we didn't know what is going on. So you did ultrasound.
And actually, this dog was around 4 years old, and the dog, when the dog around several months, the dog eat foreign body and vomit. And since then, the dog have very weak GI tract, always vomit and have diarrhea. So that's why the dog always visits the hospital. And around half a year ago, the dog was sent to the hospital also. And we gave the medicine to help the GI tract because the dog vomit. And the dog started vomit 2 weeks ago, and the owner think it's the same problem. So the owner gave the same medicine at home, but it did not work. So the owner always call and ask, why is it do not work? Why? And we tell him that probably there are something going on inside. Then we did the ultrasound, and now we are going to show you how the ultrasound looks like.
So this is the dog. We talked about this with this kidney cyst. So let's see. The dog vomited at home for many days, and then the owner tried to treat it by himself, but it didn't work. So they brought it to the hospital, and we did abdominal ultrasound. And this is the first image of liver, and here we see liver, diaphragm, and gallbladder. And this is spleen, head of the spleen. So we can see that the margin is not so smooth. So let's see more. And this is the left kidney, and also the margin is not so smooth and it's not so good. And we compared this to the spleen, and it should be brighter. The spleen should be brighter, and now it's almost the same. So something is going on with the kidney. And then we tried to find the right kidney, and we saw big mass, big cyst. And we saw that it can be connected to the kidney, right kidney, or the liver. So this is the movie. So we can see it could be connected. And one more time. So the owner wanted to do something about this, and we suggest surgery. And we did surgery, and we found the big cyst on the right kidney. And also the spleen, the surface of spleen was abnormal. It was not good. And we took off the kidney, and we saw that there is a cyst, and inside it was liquid. We cut out, and we cut this part of the kidney and sent to the lab to see.
So the results still do not come back. So we're still waiting for the result of the tissue test. Yeah.
And after the surgery, dog was doing very fine, and he was happy, and that's all.
So this is the case of Den Den, and I hope you like it. And maybe you can talk about what you think about this case, what you have learned from this case.
So I learned that if animal is vomiting, it's not always the GI tract problem or foreign body, and it's very good to see by ultrasound everything, every organs, and check also the kidneys, because maybe it's a chronic kidney disease or some. In this case, it was a cyst, but maybe it's liver, gallbladder, or whatever. So it's very important to check every organ.
Yes, I think it's very important to use ultrasound to check out why the animal vomit, and then make the plan, which plan is good for the animal. So with this good ultrasound machine here, I would like to say thanks to Dr. Koch, who provides this good machine for us. And Dr. Koch is the founder of ESFS, and ESFS has been in China for 15 years and bring a lot of knowledge to China to help to improve the small animal field of the in China. I would like to say thanks to Dr. Koch again. So thank you for watching, and I hope you enjoy this ultrasound case discussion. Bye bye.
Bye.